So I'm Dr. Sumeet Singhania. I'm a consultant pulmonologist, currently working in Kokilaben, Dhirubhai Ambani Hospital in the suburb of Mumbai, Andheri West. Yeah. So if you ask a chest physician what has been the biggest invention in the field of respiratory medicine, which has changed the way we practice respiratory medicine, it is non-invasive ventilation. So it started very early, and quite a few decades ago, but it was put into practice fairly late, where we started seeing the difference in the outcome of COPD patients when they were put on non-invasive ventilation, which would mean that they don't have to go through the process of invasive ventilation where where they put the tube in the chest and connect to the ventilator with all the problems that come with invasive ventilation and need to stay in the intensive care. And that single application, which was started for the treatment of COPD patient, has found its place in multiple other conditions, be it obesity, hypoventilation syndromes, where it is shown to do a remarkable kind of benefit to the patient. There is now reasonable evidence in neuromuscular diseases like motor neuron disease, where providing these patients non-invasive ventilation improves their quality of life and possibly survival as well. Similarly, in patients who have kyphoscoliosis, spine deformities, giving them non-invasive ventilation leads to far better quality of life, symptom control, and even survival benefit. So there are obviously challenges with non-invasive ventilation because we use it not just in acute setting when the patient is in the hospital. We are also using non-invasive ventilation when the patients are at home for providing long-term ventilatory support. Now, the non-invasive ventilation is given with the help of a mask, and there are a variety of masks available, but it is quite difficult to put that mask on because it has to be strapped around the face and the patient has to breathe through it and coordinate with the machine. So earlier the masks were very claustrophobic, they cause problems to the skin and so on, and it takes time for the patients to get accustomed to these masks and also to comply with the ventilator for a certain number of hours a day and to live a reasonable quality of life is quite difficult. Also, because it is a machine attached to you, you require constant support from the doctors, from the technicians, to keep your machines up to date, to do troubleshooting with the machine that you might be getting into problems with the machine. All that requires a lot of hard work, and that is where the challenge of non-invasive ventilation comes into. So as I said, one of the biggest problem in providing non-invasive ventilation is the interface, what we use in terms of the masks. And lately there has been more and more inventions in terms of the comfort that is provided by the mask. So we had far bigger mask, far rigid mask. Now we have gel mask which fits snugly onto the skin, and they are a lot more comfortable. They do not cause abrasion on the face. They are compatible in terms of covering the nose, and they are compatible sometimes with covering the mouth equally well. And you have now invention in terms of how the tube comes out from the mask, whether now we have a tube that comes out from the end of the mask, which is on the top of the head, so that it is not obstructing the vision. We now also have a mask which where NG tube can be put with the mask on, so it helps feeding these patients more comfortably. there is new insight into how you can coordinate the breathing of the patient with the machine, and there are the newer mast or the machine designs are looking into how best we can coordinate the movement of the diaphragm with this machine so that we get the best outcome. So as I said, more and more we are using non-invasive ventilation as a long-term treatment, and these patients require a lot of support, and the doctors cannot always go back to patients' home to provide them the support. So there is a huge need for experienced, trained personals who can provide this support at home to these patients. Some of that can always be taken up by the home healthcare agencies. There's been a spurt of home healthcare agencies in India because of the cost that is involved in keeping these patients at home and improving their quality of life. Rather than being in the hospital, they would rather be at home and have the same kind of treatment. And that is why I think we need trained technicians, company providers who can look into some of the matters which can be dealt at the home level, and the patient do not have to rush back to the hospital each time, because some of these patients, like I said, it is very useful in neuromuscular patients. These patients, to bring them to the hospital is a huge task. Yeah. So, and to have if they are too much dependent on the non-invasive ventilation, to get them transported to the hospital is quite difficult. So you are looking for someone who can do the troubleshooting at home for you, and I think there is a big role for the home healthcare people to play in this situation. So we do a full comprehensive non-invasive ventilation service in our hospital, and that overlaps with our sleep service. So we are following the guidelines which are recently published for COPD patients, which are the patients who can be put up on a long-term ventilation to prevent their recurrent admissions. We work very close with our neurology department, and we have fixed criteria about when a patient whom we suspect that can develop a respiratory failure should be referred to chest medicine, and we work together to start the non-invasive ventilation early in this patient. We are also very careful about when any procedures are to be done in these patients, because putting a PEG tube in patients who have neuromuscular weakness can be very challenging, and we work together between us, the neurology team, and the gastroenterology to do this in a very safe manner under a cover of non-invasive ventilation, as an example. And similarly, we work very close with our bariatric services to optimize these patients who are obese on a non-invasive ventilation, get them better, get them fitter for the surgery, and then follow them up following the surgery. So it's basically a multidisciplinary approach that sets us apart from, other institutes or a single person-based practice.